Serratus punches in supine. This exercise gets so many issues wrong with it. I don't even know how to say that right now clearly. With the hand forward, people think that this is a pec exercise, where even though they're saying it's a serratus exercise, what's happening is the pec squeezes and comes forward and squeezes and comes forward. In order to find out if they're actually doing this correctly, you literally have to palpate where the serratus is. The serratus is at this border of the scapula and attaches along at the ribs. So you literally have to have your hands palpating here at the ribs or underneath here. A lot of people are like, well, I don't want to be on the breast tissue. You shouldn't be anywhere close to breast tissue. Breast tissue is in the front, right here. The serratus muscle is actually down here. So if you're not sure about that, go check out the anatomy book, because it is important for you to be able to palpate this. So the other thing is, most people will think, especially patients, is that you can't lift your scapula into this serratus punch position without pulling from the pec. Now, theoretically, you should be able to do this with only the scapula activating, and of course then you've got some other muscles like the rhomboids and the mid-trap, low trap that are activating as well to help stabilize the scapula against the rib cage. Your pec, although it might be working, is not supposed to be a prime mover. And in fact, what should be happening is that it's an eccentric lengthening, not a concentric shortening across or a shortening forward. Because again, that means that we're just training a concentric exercise for the pecs, which are almost always too tight for people anyway. So the idea with this is that the scapula literally comes out and wraps around the rib cage without just jamming forward like so. On a patient, what that looks like jammed is, if she does this incorrectly, she's just coming up and forward like so, and you can literally see there's literally no muscle activating at her serratus. So if I want to make sure she's doing this correctly, I would take one hand and draw it along the clavicle to the point where I get to the humerus. And I literally am pulling it outwards. My other hand then palpates at the serratus. So here's the edge right there of the scapula. If you aren't sure, have somebody show you where this is. I'm happy to help you. And then use your thumb there, and then your other finger is right here. You can see breast tissue is up there. I'm not anywhere close to them. So right here, these muscles I should feel firing. And the only problem is she's side bending now. Hopefully you can see, can you do that again? She's side bending into it, and that's not really what I want either. I want it to draw into her, here we go. Relax for a second. I want it to draw into her abdominal muscles without side bending. So let's see if she can get a little bit of firing here. There we go. Now lift from there. Do you feel how that is? It's a completely different muscle activation. And look at this. Now she's pulling into my finger, right? So the lateral border of the scapula is now rolling up and down on the rib cage, not do it the other way. Just the pec, squeeze, release. Okay? Because there aren't a whole lot of patients that we need to teach the pecs how to shorten anymore.